once the dentistry is done, depending on the severity of their mouth, we will sometimes need to put them on an antibiotic course. Sometimes they will even need to be on a course of painkillers because the gums are that swollen, or there's so much pain or swelling or inflammation that occurs in the mouth. After that course of medication, we always do it as an included benefit with the dentistry, is that we would get them in for a follow-up exam. Most cases it will be with one of our registered technicians, just to see that the anesthetic recovery has gone well. Anything that is beyond their comfort level, to say, oh, there's been a problem, or they would just like me to have or one of the doctors just to have a look at, we will always come in and we'll follow up as well. But the big thing is we're looking at anesthetic recovery at a follow-up exam 10 or 14 days later. They go through quite comprehensively about special diets that will help, how to brush teeth, how to monitor and do the best that they can. And we do a follow-up dental exam as long as the client is able to do so within the next 6 months. And if you want to do it more frequently, that's fine. Our big thing is anything to do with the dental exam with the technician, or any questions that you have, we don't charge. So it just, our goal is to try and help maintain their teeth as best as possible right throughout the year, so that when we come in for an annual exam, maybe we will be able to avoid the dentistry every year. And again, it's a case-by-case basis. Sometimes genetics work against us, and we find that the toy breeds are much more prone to getting dental disease. And we've occasionally had that a 3 or 4 year old Yorkshire Terrier or Maltese has had to have 12 to 14 or 16 teeth removed at one time, just because the disease has been so progressive, and the healthcare and the home healthcare and the genetics have worked against this dog. So it's a sad but real thing, but yeah, it's just a very unfortunately overlooked part of the healthcare system, which I think is slowly creeping in. But dental x-rays make a huge difference when we are doing a routine dentistry, because at least we can see below the gum level. And there are so many things that I get so surprised at, because on the surface everything looks good, and then you find a broken tooth underneath there, or otherwise you have a tooth that's been missing that looks like it's been removed or fallen out, and you find remaining remnants of a root, and they will all cause problems. They're all potential abscesses, or they're all potential sensitive areas for these dogs. And very frequently we'll see a dog or a cat's mouth being much worse on the one side than the other side. And the simple reason is they're eating more and crunching more on the one side than the other, because it's too uncomfortable on the other side.